Well, I'm back with Dr. Kennedy. How are you today, Dr. Kennedy?
Well, it's a sunny day, Janice. It's been a great weekend, so people are out and about. So it's beginning to look a little bit more normal than it has been over the past 2 or 3 months.
Yes, and I know a lot of people are very happy about that. What's the situation at the hospital right now?
Quite good. We have 3 COVID positive patients in the hospital. They're not in the ICU. They are stable, and they're on our 3A COVID unit. We only have 9 presumptive swabs. We're waiting to get the results back, and that's because we have a better turnaround time. Our hospital capacity is about 81%. We only have, in Thunder Bay, we only have 6 active cases in Thunder Bay. 3 are in hospital right now, and I think those 6 active cases are getting close to be over their 14-day limit. So I think Thunder Bay as a whole, only 87 cases in total, 6 active cases, doing lots of more testing. We have over 15,000 tests completed, and again, only 87 positive. So I think as far as Thunder Bay is doing and the hospital doing, we're doing extraordinarily well, and our PPE supply right now is quite good. So that's why we're considering to increasing the volume of outpatient and well as surgical programs next week to maybe up to 50%. But we're still meeting as a team to make sure we are on a correct track to make sure we are putting no one in danger.
Right. Well, that's good news.
Yes. Yeah.
Has anything changed with the testing?
We're just now the public health lab is open. They're not at full capacity. I think they're doing over 100 test kits a day, and they have a capacity to go over to 300, and that will be coming up very shortly. And we're getting more supply in from our supplier here at the regional. So we have capacity right now to do about 120 to 150 a week. So we're actually doing more timely turnaround time. We're just doing most of our testing either in-house or in city. Some still has to be sent away, but very little.
Now, are you able to do walk-in testing yet, or do you still have to call the health unit to make an appointment to get a test? Because I know everyone can get a test if they want to.
So at this point in time, we don't have the sort of organizational structure to do the walk-ins, but it's pretty well a walk-in. You phone the public health, and they will give you an appointment at the assessment center. And there's no long wait list at all. So it's just more from an organizational perspective, because doing the walk-ins in that trailer outside the emergency department really is not conducive to walk-ins. Maybe once we go to a more permanent assessment center site over the next several months, we can actually do more walk-ins. At this point in time, there's not big waiting lists at all. We just can't afford to have people waiting outside for the walk-ins that put themselves at risk. That's all.
Right. The last thing you want is gatherings of people right outside waiting to be tested.
Exactly. Yeah. Yeah.
Now, is there a difference? There is mouth testing and nose testing. Can you choose which kind of test you want? And what's the difference between the two?
No, it's just the availability of swabs. So that we have here to do. So both testing is both methods are just as effective. What you're trying to do is get the saliva or the mucus either from the back of the throat or the back of the nose where things are harbored. So there's no difference in the science of it. They still have to be cultured and grown, or tested both with the test kits as well as the DNA extraction. So the results are the same. And I have never experienced the throat or the nose at this point in time, but I hear they really are not a painful experience.
Okay. Now, I know last week we talked, you were doing some targeted testing. Is that still happening?
There's certainly, we had done a lot of targeted testing. Sort of long-term care is being tested every several weeks. So that's some of the targeted testing. Certainly in the homeless, looking at the vulnerable populations, that's still targeted. We will do any healthcare workers coming from outside northwestern Ontario. That will be targeted. And certainly, but anybody who wants to test right now, they can just have to phone the public health, and the appointment we made, and they don't need symptoms. So we're doing sort of the public who wants the test completed, actually. So we're doing both asymptomatic and symptomatic and targeted testing now.
Okay, now last week we had some good news where the province opened up some things and we were allowed to gather in up to 10 people. What do you think? What is your thoughts on that? What does the community need to know about about that situation.
So did you get your haircut cut yet?
No, not yet. I have a week. I
Okay,
go in a
I've
week.
got a week. Okay. I think we need to get back to a sense of normal. The province is doing very cautiously, and I think the regional type of opening is a good thing because, as we said, we only had 6 active cases here in Thunder Bay, so our prevalence of disease is low. So allowing the restaurants and patios to open up, to be allowing individuals to get haircuts, to be allowing individuals to actually go to, play tennis, I think is a good thing to be back to normalcy. But you still got to maintain those principles, and those principles still are to keep your 2 meters distance and wash your hands and wash your hands. I think the province has also allowed gatherings of 10 or less. And so all those things are a graduated approach to getting back to normal, things where we have to go. But my only concern there, Janis, is if they get too liberal, the province and individuals, to begin looking at opening up the border to United States, I think that would be a dangerous move because the amount of COVID it's increasing in the United States. So I think I would encourage, if I had anything to do about it, to make sure that border continues to be closed, except for essential travel and essential trade, as long as we can. And now that we've opened it up to outside northwestern Ontario, I think we need to, again, be cautious. I think we want to welcome people coming up from Toronto and other places in Canada. But again, we want to make sure that caution is used. And that's why the principles of public health still be adhered to, because we do expect a second wave. China is experiencing it right now, not to the great numbers they have. Certainly, New Zealand pride themselves on having no COVID cases for the past 3 weeks, I believe. But as of yesterday, they've had 2 COVID cases from travel outside of New Zealand. So it's going to be with us, and we just have to be prepared and follow the public health guidelines.
Now, the health unit stated last week that if you travel outside of your province, you can travel across Canada, and when you come home, you don't need to self-isolate. Do you think that will be a problem?
Well, we're going to maintain our sort of restricted travel from outside Northwestern Ontario at the hospital level. So if you come to the hospital and you have traveled outside Northwestern Ontario, you will fail the screen. If you're a healthcare worker, we're just actually sort of finalizing those recommendations right now, and you need to come back to work, we will swab you, and if you have no symptoms and you're negative, you'll be able to come back to work at Thunder Regional Hospital. But I think if you're going to a high area that has resurgence of COVID, our occupational health department here at the hospital review your status, and we may decide in individual cases that you may not be able to work at the hospital because you come from a high risk area. So each case will be taken individually. As far as visitors to Thunder Bay, as long as you're not coming into Thunder Regional Hospital, I still think it's important to, again, keep your 2 meter distance. And I don't see any need to self-isolate because at this point in time, the amount of COVID outside of Northwestern Ontario is also low, except for a few areas that are on the rise. But, Winnipeg, Manitoba, Saskatchewan, even BC, their numbers are quite low. But certainly if you're coming from a high endemic area, we still encourage you to wear masks and wash your hands. And that's another thing I'd like to say is that, Janis, is that I was out this weekend and I was surprised at the amount of individuals not wearing masks. I know it's not mandatory, but out of respect for the employees at these areas of business, I still think it's a great idea that if you can't keep your 2 meter distance, that you should wear a mask so you prevent any potential spread of disease from yourself to somebody else, especially if you can't keep that 2 meter distance. Again, it's not required by the city or the province, but I do think it's a good sort of plan to help prevent the spread of COVID for the time being, while we're still learning more and more about COVID-19, and especially now that we're opening up travel outside of Northwestern Ontario, I think it's important to follow those rules.
Now, sometimes when I've been out, I've seen people driving with masks on. This morning I was out and I saw someone walking by himself with a mask on. Is that necessary?
No, from my perspective, the main principle is keeping that 2 meter distance. If you're unable to keep that 2 meter distance, then you should wear a mask. But within the car, you're alone, there's no need to wear a mask. If your family's in with you, there's no need to wear a mask because you're in that circle, the family circle. If you're out for a walk on your own or a jog, there's no need to, unless you're into a high density or high populated area where you can't keep the 2 meter distance. So you don't have to wear the mask all the time, but certainly in public places where there's closer contact, I would encourage it.
I just have one more question. I know we talked a little earlier. We talked about that if you leave northwestern Ontario or leave your province, when you come back, you'll fail the screening at the hospital. What does that mean? Does that mean you're not allowed back? You won't be allowed into the hospital if you fail the screening because you've left town?
Right. So if you came to the hospital for a medical need that you had to see somebody, you would fail the screen. But then you'd have to put the mask and the gloves on to protect everybody else. So you'd be sort of isolated the best we can with proper PPE. As far as if you're coming in from, if you're a worker, you would still be allowed to come to the hospital and work as long as your COVID swab was negative. So again, we don't want to discourage people from coming to the hospital, but we will just treat them a little bit differently at this point in time.
Okay, and if you do travel outside of your province and you go somewhere, when you come back, can you make an appointment to get tested just to be sure for your own peace of mind?
Absolutely. Yeah, we're doing all asymptomatic patients, so you just have to call the assessment center and get tested. In fact, with the new long-term care guidelines, I just announced this week, I believe, is that you can visit your family in the long-term care. You've got to keep quite a distance away. It's got to be outside, but the people visiting need to be tested. So they need to be tested within a period of, I think, within the 7 to 14-day area. So they can also get tested before they visit their loved ones in long-term care facilities.
Do you see that changing at the Thunder Bay Regional anytime soon, where opening it up to a little bit more visitation and having I guess care workers come in with your parent and you want to go in with your parents?
Yeah, we have such a vulnerable population here. We really need to take all precautions the best we can. So we are sort of opening up to essential care partners over the next several days where you've identified as an essential care partner. And that's important to actually maintain that family, that friendship that you need to actually, in the mental health perspective. But as far as opening up to a wider range of visitors to the hospital, we're still debating that, and from an infectious disease perspective, because the more people you have into the hospital, the more potential they can bring COVID-19 into the hospital. So if you're a visitor, if you're an essential visitor to the care of that sort of patient, I think we need to move that along. If you're just coming to visit from a social perspective, I think it'll be a long time off until we allow that again.
Okay, and you did mention that hopefully by next week or the week after, we'll be opening up more surgeries and more testing to try and catch up to the backlog that we have.
Yes, more diagnostic tests, more MRIs, more CT scans, and a gradual increase in our surgical capacity. So that will be discussed at our IMS meeting probably Wednesday, and we'll make that decision soon regarding the increasing our capacity for elective surgery and procedures.
Okay, well, I hope that happens. Thank you so much for talking with us today, Dr. Kennedy.
Okay, thank you again, Janis. Have a good day.